Hey guys, we're back to talk about second of three talks about diagnosis of endometriosis. And last week we were talking about how, on average, there's a 10-year delay in the diagnosis of endometriosis. There's no current diagnostic test for endometriosis, and so it's got this rep that it's really hard to diagnose and treat endometriosis. And the net result is we have millions of women that are in pain and suffering, to me, unnecessarily. And recently there's been a bunch of talk about there's new tests coming online that may be available to diagnose endometriosis, and at best we're years away with having a useful test. And we can talk in more detail about some of that stuff because I think some of it's wishful thinking. But how do we change it today? I mean, it's ridiculous what people are going through, what women with endometriosis are putting up with, and I think, to me, it's not that difficult. And I'm going to share that with you today. Some insights that I've had with dealing with this over all the years, and maybe even a secret. So I hope that by the end of this talk, you'll be able to get yourself a presumptive diagnosis of endometriosis or not. So what we're talking about is, let's go back to the basics. I mean, with all the noise and confusion, it's easy to go down these rabbit holes of, this study and that. What about the basics? Again, I started in 1996 talking to people on the telephone through the internet and about endometriosis. And just like if you, from the history, I think we can make a very accurate diagnosis of endometriosis, or at least a presumptive diagnosis. And with that, what is that? Well, okay, there's a classic kind of story that goes along with endometriosis. It doesn't mean that that's the only story, but if you have that, then almost certainly you have endometriosis. And that is, if you start with your periods, they're not too bad, mild cramps, no cramps, moderate cramps, something kind of in the normal range, not this killer horrible cramps. And over years, through junior high, high school, college, the periods are getting worse. The pain's getting worse. The number of days are getting more prolonged, more days during the month. If you start having pain with intercourse, pain with bowel movements, lower back pain is very classic for endometriosis. So if these cyclic symptoms are something that you did not have when you first started having periods, and you've gotten those over the years and they've become progressively worse, you almost certainly have endometriosis. And so if we stop and just ask some questions and listen to what the patient's going through, they're going to tell you. And you say, well, does it really? Yeah, if you're sitting in your house and you hear a car go by, do you know that's a car? You go, well, no, I've heard that enough and I know that's a car. So with endometriosis, I've heard it over decades and I know, and then I go look and see, and there's, I would say, at least 90% accuracy in diagnosing endometriosis. And so we can do that today, and we'll go into different aspects of diagnosis and treatment over the next few weeks. But in general, what we're talking about in medicine is a two-tiered level of testing. And we have that right now with endometriosis, if nothing else, and it may be better than that. So the two-tiered involves screening test and diagnostic test. And so the idea is the screening test is a lot cheaper. We can do it on everybody. The diagnostic test is more accurate than the screening test, but it costs more. So say we have 1,000 people that we suspect to have a condition like endometriosis. If the screening test will tell us we think 150 of those 1,000 have it, and we know 100 have it. But the test shows 150 have it. 90 actually have it, so that would be a sensitivity of 90%. We missed 10%. And then you take that 150, you do the diagnostic test, and it tells us which 90 have it. And so arguably this may be truly a diagnostic test, the history of what people are going through, but we can at least say that it's an effective screening test, and that would tell us, based on how responding to treatment, if we need to do a diagnostic test being the laparoscope, which we're going to talk about next week, because it's highly variable how accurate that is depending who's doing it. So take-home point is, if you're in pain and suffering and you've had progressive degree of pain with your periods, progressive number of days that you're in pain, pain with bowel movement, pain with intercourse, lower back pain. Until proven otherwise, you have endo, and don't stop until you find somebody to work with you to figure it out. All right, that's it for this week. We'll talk to you next week.